Hi, everybody. I'm Nina Bosky, and welcome to Mental Health Mondays. This is a special treat because she is one of my favorite people. Her name is Dr. Bergen Nelson. Hi, Bergen.
Hi.
So
good
excited.
To be with you.
Well, it's great to be with you. And the thing that I love about you is that as a doctor, a lot of times some doctors, I'll not say all doctors, but some doctors don't have a great bedside manner. And I wish we lived closer because I would have you be my doctor because I'm like, oh my gosh, you're just so yummy on so many levels. Not only is she smart, guys, went to Harvard, she's a pediatrician. Wouldn't you want this wonderful, yummy energy just taking care of your children as well? So she's got a lot of background. She's certainly got the credentials. And I want to talk to her today and talk to you, Bergen, about a very important subject. And, we are living in a very, let's say, a challenging, hectic, adventurous year, to say the least. We're in the middle of a pandemic. We're in the middle of a huge cycle, an election year. And the focus of the topic today is really talking about the vaccine that's coming down the pike, talking about, children and going back to school. Should they stay home? Should they go back to school? And then whatever tips you would like to give parents out there and for all of us to help us during this unprecedented time in history. So with that, let's get started. All right. So one of the more controversial issues, and let's start with the vaccine. I didn't realize it was so controversial until I started talking about it with people. So what are your thoughts about the vaccine? And then I'll intersplice some of my story that I've been hearing as well. What are your thoughts about it? Because there's a lot of mixed messages out there in the media.
Yeah, I am very hopeful about this vaccine. And I'll tell you, first and foremost, I'm a pediatrician. I believe in vaccines. I think vaccines are one of the best public health interventions we've had in the past century. And in the midst of all this bad news of this resurgent pandemic, the vaccine has been one of the most hopeful elements I've seen out there in the last few weeks. And I'm just really excited. I do believe in science. I believe in the vaccine testing and approval process. I think this happened in a very fast, really unprecedented way in terms of how fast it went through the process, but I believe that's because it was an unprecedented outpouring of resources. There have been billions of dollars in terms of factories and support for these vaccine manufacturers and researchers, and they have removed a lot of the normal bureaucratic barriers that are out there, and so it's made the process go much more smoothly. But I do not believe that they have cut any scientific corners. I believe that they've tested a huge number of people and that it is safe and effective, and I'll be the first in line to get it myself.
So it's really interesting because you and I had part of the reason why we're doing this Mental Health Mondays is because I have the exact opposite feeling, at least right now. And I probably am on the other side of the controversial issue, which is, no, I'm not ready to take a vaccine yet. And I had to go inside and ask myself, why not? And it comes down to trust. And so it's interesting that you said, I trust the science and I don't think that they're taking any shortcuts. And the challenge with that is how do we know? How do we know for sure? Because as we have also been told, big pharmaceutical companies have taken shortcuts and each one wants to be the one that wins this vaccine kind of account, so to speak, which is America. I know that there's other vaccines that are actually being tested and actually I think being implemented in the UK, I believe. So what do you say to that? Because I don't think it could be an either or. I think it's really good to have the discussion versus I believe this, and then there's no dialogue.
Absolutely, and I'm all for asking questions and having the discussion, and you're absolutely right. The very first recipients of the tested vaccine were in the United Kingdom just this morning, so it's very timely. I hear what you're saying about mistrust of sort of corporate interests and pharmaceutical companies. But I do think that as a society, as a collective, people like Anthony Fauci and the NIH and the CDC and people who don't have strong financial interests in this process have been very much leading the way, setting the standards. There are very rigorous scientific standards that people have to go through. You cannot cut scientific corners. You can make the timeline go faster by recruiting people fast. And I think people were so interested in getting a vaccine that people were lining up to volunteer to be in these studies. Again, if you can remove some of these bureaucratic barriers that are often in place with research, then you can make the process go much faster.
Well, it makes you realize that what you can do when everybody's working together to do something. So I certainly agree with you on that. And I, in the months ahead, I will certainly be looking to you to give some guidance. And I think for everybody that, trusts their medical professional and to look at, the people that they do trust, because this is a very important time in history. And, one of those things that I think is really important is to have these discussions. And so one of the things that happened, and I was sharing this with you, is that over the weekend, I was in a birthday celebration. It was a social distancing. We're all on the beach and we started talking about this. And there was 5 of us. 3 of us, no. 2 of us, hell yes. So of course, I've already shared with you that I'm on the no factor. And what I found is the other 2 was the distrust. So one worked for a pharmaceutical company and said, I've seen them do it, where they cut corners in order to get the drug or something implemented out in the marketplace. So I think that, with the vaccine coming down the pike, when do you think, they'll be testing, there'll be months, and I agree with you, it'll take years in some cases, and now we're doing it in months, which is wonderful, is for people like myself that are less likely, what would you say to us to kind of calm down those fears of that mistrust feeling?
Yeah. So the process of approving a vaccine is independent of the folks who are manufacturing the vaccines. That's important. The people who developed it and tested it and manufacture it, and then the folks doing the approval, looking at the data in a scientific way, that's an independent body of people that don't have that financial interest, and their names are not published, and so they don't even get credit. So I do believe that they're doing this really out of concern for society and changing the course of this pandemic. So again, I trust all the processes that they have to go through, even though there are people that want to get there faster. But I think you're right. You nailed the nail on the head when you hit the nail on the head when you said that when everybody's focused on one thing, and everyone's attention is placed in this one area with a lot of resources, we can really get a lot done pretty quickly.
Yeah, it makes you realize how much the bureaucracy of people just not wanting to work together. So I do think that's a very positive. I'm not sure if you have looked into this at all, but it's certainly one of the things that are out there that are really causing people to pause too. It's the more of the conspiracy, bigger picture, plandemic, documentary that got pulled and all this stuff that's out there. And, the vaccine is then going to be able to rearrange and be able to tap into our DNA or potentially change it. What would you say to that? Because that for some people is a very, very real thing. And even for myself, Dr. Christine Northrup, who I actually admire and I've read her books. I mean, she's all about, especially for females that are getting older. So I've really trusted her guidance. She's been on Dr. Oz, Oprah. She basically said, absolutely not, because it's changing. And I'm not a medical doctor. The RNA that has the ability, the next step is your DNA. What do you say to that? Because that to me is a real concern as well for people that are already in a distrusting environment. How do we handle that kind of information coming at us? along with what you're saying?
No, these are good questions. I think we need to question everything. I have not seen any evidence that the sort of sources and evidence in the movies, The Plandemic and this conspiracy theory about this virus has any merit at all. I think that's mostly been discredited. And I do, like I said, I'm a pediatrician. I believe in vaccine technology. I trust Dr. Fauci. I do think this is a new technology, so that's understandable. This is an mRNA vaccine. There have been now 3 or 4 that have been tested and seem to be effective, but the 2 first ones are mRNA vaccines, the Pfizer BioNTech and then the Moderna one. And that is a new technology. And so I understand people's concerns, but again, I think if we go through the process of testing and we know the side effects and we really get a rigorous safety profile. And I understand if somebody like you may not be interested in being the first in line to get the vaccine.
No.
Okay. Ultimately, to really change, to get herd immunity and to change the course of the pandemic, we will need a majority of people to get the vaccine. It will not work if a small minority of people get it. I will be first in line. And as soon as it has not yet been approved in children, has not been thoroughly tested in young children, but I'll get my children to get it as soon as it's available to them. I trust the process, but I think we will be able to see over the long term what some of the safety issues might be. But so far, there have not been concerns.
I think that's a really important thing, because that was the other thing that I'm concerned about. And I understand, I want to give credit where credit's due. We've never gone through anything like this. And so information is changing on a daily, weekly basis. But Dr. Fauci was talking about 8-year-olds potentially getting the vaccine. And just last week, he's now talking about 4 or 5-year-olds getting the vaccine. Do you see? And now we have to remember, it's not like it's set in stone. What we knew in March isn't what we know today, right? So I'm not holding them to what they said in March compared to now or a few months ago. But what's challenging sometimes is that they don't clarify. Hey, I know 2 months ago I said that an 8-year-old, I would be comfortable having them. Now I'm to 4 or 5-year-olds. What's the change that made him change his mind? Because when you don't get that information, it then goes ahead and supports the distrust. Because do you guys really know what you're talking about? That's my feeling. And I trust Dr. Fauci in so many other areas, but when he said that, it really did cause me to pause and go, wait a minute here. You just told me a month ago that it's 8-year-olds. Now it's 4 to 5-year-olds. I mean, and I know for the controversial issue that we have about the vaccine right now with parents, some people don't believe in them at all. Some people do. That kind of ability to have these kind of conversations, in my opinion, is so important. And unfortunately, general mass media does not talk about this stuff in an intelligent way. So here we are. You're a doctor who has got high level of credentials. You've got me that does not, and you're basically, and I trust you, and yet I'm not ready to change my mind yet. So the fact that we can have these kind of conversations, and what I would love, Bergen, is that, the people that want to have the vaccine versus the people that don't, that we can have more dialogue about this so that we can, kind of mitigate some of these fears that people are having. So do you believe a 4 or 5-year-old should have a vaccine?
When it's tested in children, I don't think it's ready right now. It has not been thoroughly tested in children. So part of it is the priority of the populations that need the vaccine soon. So healthcare workers, essential personnel, people living and working in long-term care facilities, teachers, older people over 65 with comorbid conditions like diabetes and heart disease and lung disease. Those are the priority populations that are at risk for catching the vaccine, for the virus, for getting coronavirus, but also for having potentially severe illness. We know in general that children get relatively mild illness. There have been relatively few severe cases and deaths among children of COVID-19. And that's been just one of the just the one kind of silver lining of this as a pediatrician and a mom to two young boys, that I'm not worried for my children. I'm more worried for my mother, who's a cancer survivor, or some of my family and friends who are older. So I think part of the reason things that there is a moving target is that initially the priority is for older children and adolescents, because they're the ones more likely to get sicker, they're the ones more likely to transmit it to others. And if we can give it to those populations, then we can get them back into school and those kinds of things. I think that soon children will be tested and then we'll know whether it's safe or not.
Because I think that's really important. And, you know, I think, like I said, there's so much information coming at us, and it's, you know, I think also the challenge is it's perspectives, not necessarily facts that we're getting in our media. And that even becomes more challenging. You know, you and I are giving perspectives. You're giving your perspective as a very you know, have a lot of credentials in terms of the medical field. I'm giving you my perspective, and I'm a layman. You know what I mean? It's like I'm the everyday Joe talking about my own fears and distrust. But I do think that if we can give people the ability to make their own choices, that's why, you know, when I listen to Dr. Oz, I love his style, because he gives you the facts is how he knows them. And then he says, America, you know how to make up your own mind and what's right for you. And I think the challenge that we're having is that we're not having different perspectives. We're having different perspectives with an agenda, as if I am telling you the truth. And this is a definitely moving target. And one of the other moving targets right now, to kind of piggyback off this conversation, and you know a lot about this area, I'm sure you get asked this a lot. Should my child be in school, or should I keep them home? So what is your stand on this subject?
Yeah, this is a really controversial subject, and I don't, want to spark controversy or get in trouble. But I do stand by the American Academy of Pediatrics statement that said we should prioritize children getting back to school in person. That does not mean we should do it everywhere right now in the midst of spiking cases. What we know about cases in schools is that it reflects the level of community spread. So if you are talking about a place where there's a lot of community spread, it may not be the safe moment for everyone to come back to school in person. If there are locations where people have gotten things better under control, I think that we can get kids back, especially young kids, back in person safely if we provide enough protective equipment for teachers and all the other personnel working in the building, if we do really rigorous screening and protocols in terms of keeping people with masks on and washing hands and socially distanced. But I do think that education is essential. I have two young boys, as you know, they're 7 and 9. They are in 1st and 3rd grade, and they've been entirely virtual since March. And that's been really hard. It's been hard on them. It's been hard on my husband, who stays at home with them while I'm here at work. It's a stressful time for everyone. And I'm really looking forward to the time they can get back. But I totally appreciate the concerns of teachers and bus drivers and cafeteria workers and custodians and all the adults in the building who are concerned. And so I do think that people should have choices. And I think a lot of resources and support should be going toward having this happen safely. But I do think we should prioritize education. I think schools should open before bars, for example.
Well, you know, you're saying some really good stuff here. And I think one of the other things that we have to look at, because it's systemic. So you make a decision to keep them home, but after a period of time, the challenge that we're experiencing is there's, in some cases, major spikes in certain areas I'm going to touch on: domestic violence, sexual and child abuse, mental health issues, the lack of socialization. Some kids that, if they're not going to school, they're not getting fed properly. So that might be their one, meal of the day, or at least some type of nutrition that day. So we're trading keeping them home, and then not to mention the educational aspect. Not every child, especially young children, can sit in front of a computer for hours and think that they're going to just take it all in. I'm a right brain, I'm a right brainer, in terms of, I was very creative growing up. And so I just can imagine being as a first grader, having to sit in front of a computer. I'd get bored.
Yeah, yeah. So my youngest was in kindergarten, halfway through kindergarten when everything shut down. He was just starting to learn how to read, and it felt so tragic. Just as those synapses were starting to fire, those connections were being made for him to have to be home. He's doing okay. He's hanging in there. But I think you nailed all of those things again, all of those issues, and we really have to think about the risks and the benefits and weigh those for any individual family, a child and a family. So I think in general, for a young, healthy child in a situation where they can go back safely and do all of the recommendations in terms of wearing a mask and washing hands, and they don't have a lot of underlying medical illnesses, that the benefits of being in school outweigh the risks of coronavirus. And for younger children, it's harder for them to access the curriculum virtually. They just don't get as much from a screen as they do from a live person.
Also, that's a really important time of socialization for a
Absolutely.
child too. So I'm concerned with it going on longer and longer and longer, not having that interaction, because that's also part of the learning and development as well. So I think
Absolutely.
I want to recap what I heard you say, and let me just make sure I heard it right, is that in cases where there isn't a lot of spiking going on and that they've gotten their COVID cases under control, that absolutely you align with the Association of Pediatricians, or the National Board of Pediatricians, that says it is safe for children to go back in certain cases, and so that you do support that for everything that we just talked about. And in that, for children, that it's really important, particularly small children. What do you say though to the teenagers too? Because I think part of that, and I was sharing with you, I had a friend who had an issue with her teenage child, and the challenge with teenagers is that you're also wanting to break out in terms of breaking the rules. So sitting, getting bored again is really another challenge that I'm sure a lot of parents are having, because they can't sit there and babysit their teenage child to make sure that they're not only doing their work, but they're happy, whole, and all that stuff that goes into parenthood. Especially, teenage time is such a difficult time as it is. And then you put a pandemic on top of it. What would you say to some of I know you're a pediatrician more than, the older teenagers, but what would you say to that?
So I actually just had clinic this morning and I saw a pair of brothers. One was 13 years old, one was 15 years old, and we talked about being in school virtually versus in person. And I think it really, in adolescence, is very individual, honestly. I think some kids are the social butterflies. They really thrive on being with people and that socialization. They get depressed when they're at home and isolated and secluded, and that is a problem. And I think
That would have been me. That would have been me.
the extroverts among us are not okay with social distancing. But then I think there are other people. I know some young people on the autism spectrum who have a lot of trouble with socialization, or people with social anxiety, or people who are getting bullied at school, who actually, for them, being virtual has been a great blessing, because they can be in their own environment and do what they want to do and not have to interact face to face. So I think it really, as parents, we need to understand our children and what they need and their strengths and their challenges. And I think teachers are also very good at thinking about that individual child and what is best for him or her.
I think that's really important. That's a great point that you're making, is that it depends on the child. And because I have heard the opposite as well, where my child is thriving at home versus being, antsy and wanting to, the socialization. And I think that's a great way of saying it, the extrovert versus, and it might not be introvert, but like you said, social anxiety, and the things that go into, making this very challenging time, not to mention for parents that have to oversee this, potentially working from home themselves, or like you have a husband that is at home right now, and then you are obviously having to be at the hospital and seeing patients and stuff. So it becomes a real challenge in of itself. Time management, being able to be present with your children. It's not an easy time for parents. And I think, one of the last things I want to talk to you about, Berrigan, is what would you say to parents particularly that are trying to navigate this space. They're trying to make really wise choices for themselves, and yet they're not exactly sure how to do it. And they might even be trying to manage their own anxiety and calming their own self down. What would you say?
Yeah. So in general, I would say we need to not live in fear, but we do need to take this seriously. So we need to stay safe and do it the best we can as individual parents. And you're absolutely right. Parents, everyone is stressed out, but parents are especially stressed out having to navigate school and childcare and working from home. I've done it a few times trying to be home with my kids, and it's ended up with tears and yelling and me swearing and basically giving up. So my husband is doing a much better job than I ever could. But I feel you. As to all the parents out there, my heart is with you. And I know that a lot of us are just kind of in survival mode, just getting through day by day. And what I would say is take care of yourself, take care of your children and your family, and really stay with kindness and love more than staying on your schedule or getting everything turned in on time. I think that social emotional piece and trying to reduce stress are really the most important things right now, more than anything else. And so whatever you have to do to create that calm within yourself and your home and your family and making your children feel safe and secure, please try to do those things. That kindness, wellness are the most important things right now.
Doctor's orders: create calm, create kindness, create love. That's your prescription for a happy, healthy household. Not so much the perfection of getting it all done. And I think a lot of times that we run on a schedule because, hey, we got XYZ to get done today, and I need you to be doing this. And I think what I hear you saying is if you can take a step back, create that calm, create that connection with your child and your family, that's more important than the specifics of what you're doing.
We're all just trying to get through this, but we're getting through it together.
We certainly are. And I want to thank you, Dr. Bergen, for being with us today and sharing some of your insights in this very interesting time of polarities, of divisiveness. If she and I can have a conversation about some of the things that we don't necessarily agree on at the moment, I can listen to her, she can listen to me, and we can build a bridge. And that's what's so needed in our media today. So I want to say thank you so much for being with us. I also want to share with the Mental Health Monday audience in the Maryland Life Bites community that Dr. Bergen and I will be doing in 2021. We'll be once a month, we will be doing a interview series in the Be Well Wednesdays on the Life Bites Facebook page. So please join us, and you'll be hearing more from this wonderful, not just doctor, but human being. So thank you, Dr. Bergen Nelson.
Thank you so much.